morning and welcome to the Surveying the Pulse of Long Island Summit with HIA-LI. I'm Eliud, Custodio of Turn One Studio, and I have the pleasure of sitting with Christopher Nelson from St. Catherine's. How are you?
Very good, thank you. Thank you for having me.
So, as I mentioned, I'm happy we're getting to talk before the summit starts. I'm very curious about what you think the panelists are going to say about the outcome of the survey.
I don't think anyone will be really surprised.
Okay.
I had the opportunity to review the survey in detail. And I think despite what industry you're in, I think we all have the same concerns. And, cautious optimism about the economy of Long Island. And I think we're all under the same pressures, whether we're in healthcare or banking or any industry.
Fair enough. So I noticed when I looked at the survey myself, it seemed like optimism is up for 26, but not as high as 25. Are you seeing that in your business, or do you agree with that?
Yeah, I do. Healthcare is very unique. I think it's different than a lot of the businesses you'll hear from today. From our perspective, we're dealing with some of the same things, right? We're dealing with inflation, we're dealing with tariffs, we're dealing with increased labor costs, and really, those key cost drivers I think we're seeing across all industries on Long Island. Healthcare in particular is a little different. We have extraordinarily tough regulatory requirements, a political environment that's shifting.
Right.
Insurance company behaviors that, are really making our business very difficult from a revenue cycle perspective.
Okay, so speaking of insurance, when they say increase costs, are they using the same, I don't want to say excuses, I don't want to sound negative, but is it the same rationale of tariffs, inflation, to justify their change?
Interestingly enough, I think we need to change the narrative.
Okay.
Both in policy and public perception, I think the hospitals really get a bad rap.
Okay.
What you see is a lot of narrative around the hospitals being the main cost driver of healthcare.
Okay.
Cost increase. And there's very little attention paid to the other industry players, pharma, the supply chain, and just labor costs in general. On Long Island, we deal with one of the most competitive labor markets in the country. We're all competing for the same pool of resources and same pool of talent, which really is giving people mobility. From healthcare, when you talk about nurses, we're not just competing with other hospitals. We're competing with doctors' offices, we're ambulatory centers.
Oh, okay.
We're dealing with competing with insurance companies, school nurses. There's a lot of options for those folks. And since we're all competing for the same pool of talent, it really drives labor expense up.
Right.
It's almost a bidding war at times. You hear a lot about nursing shortages. If you're watching the news, you're seeing it in New York City with the largest nursing strike that New York's ever encountered. And that's primarily due to staffing and staffing shortages. And it's a reality that we're having to deal with.
Right. Well, it makes a lot of sense on the competitive set with private practices and whatnot and schools, as you mentioned. Is there a shortage in the younger generation wanting to pick up those career paths?
So, certainly I think we need to train more nurses.
Okay.
And I'm hoping that, we are able to get policy that gives incentives to nurses, tuition forgiveness if they continue to work in from state schools. But, when you take a look at the demands and the needs, the demand for patient care is rising.
Right.
We have an aging population. If you look at Long Island's demographics, the demand for healthcare services is on the rise.
Well, the size of the boomer generation from a retirement standpoint is massive.
You got it.
Yeah.
You got it. So, we're still also experiencing some of the aftermath of the COVID pandemic.
How so?
A lot of senior and seasoned healthcare professionals, nurses, technologists, exited the workforce after COVID.
Okay.
Many retirements, and we really are trying to backfill those folks with the younger generation of nurses and healthcare professionals.
Yeah.
Many of which don't have the same experience as some of those, seasoned professionals. So, where you may have a seasoned professional being able to take great care of a larger census or a bigger population, the newer nurses need to ramp up to that. It takes time. So, I think we definitely are seeing workforce pressures and labor pressures that I haven't seen in my 25-year career.
Wow. So looking at your business as a whole, is it safe to say that if you can solve the labor issue, is that the biggest driver for improvement in your business, or is
No,
there another factor?
No, not
okay.
at all. I think that's one component. It's a very complex industry. One of the biggest drivers right now is and I shouldn't say drivers, but I should say concerns, is policy change.
Okay.
You know, the reality is that payment to hospitals are not keeping up with the costs.
Okay. So cash flow is getting tighter.
So I'll give you an example, at least for Catholic Health. For Catholic Health, and St. Catherine's in particular, for every dollar we spend to take care of a publicly insured patient, Medicaid, whether it be Medicare or Medicaid, on the Medicare side, we're typically reimbursed about 89 cents to every
Really?
dollar of spend. On the
Okay.
Medicaid, I'm sorry, that was Medicare.
Okay.
On the Medicaid side, it's about 70 cents. So
And you're just expected to eat the difference?
we absorb those costs.
Okay.
So, you know, it makes it very difficult. And because Long Island has such a high prevalence of chronic disease, again, we have an aging population and our demographics that are requiring more and more care. And because of the aging population, we see a lot more Medicare.
Yeah.
And, you know, it's a squeeze for us. You know, I think what we need is higher reimbursement from Medicare and Medicaid that is geographically indexed. Long Island's our cost of doing business here is higher than most places in the country.
Right, you can't just use the national average.
That's right. So I'd love to see things that are regionally indexed, and we really need more consistent and predictable reimbursement from the public insurers, Medicare and Medicaid.
Fantastic. Well, this was super insightful. I don't want to take up any more of your time, but I thank you.
No, well, thank you
I
very
look
much.
forward to seeing the panel.
Thank you for having me.